Good evening. My name is Dr. David Doman, and welcome to another edition of Housecall. Do you have a big trip coming up? What kind of travel medicine precautions should you take? Find out right now. My guest this evening is Dr. Jane Chretien, a specialist in travel medicine. Dr. Chretien, welcome to Housecall.
Thank you for having me here this evening.
My pleasure. So briefly tell our viewers about your professional background.
I went to medical school in New Jersey, which is now Rutgers, New Jersey College of Medicine. And after that, I did an internship at Bellevue in New York City, did my residency in internal medicine in New York City in Bellevue Cornell program. After that, I got a master's degree in public health from the Harvard School of Public Health. And then I came to Washington and did a 2-year fellowship in infectious diseases at Georgetown. Worked for hospitals in DC for a few years, and then was a founding partner of private practice, Bethesda Physicians, here in Bethesda, Maryland, starting back in 2001.
Very nice.
And our practice is a primary care practice. We take care of children aged 12 and up and all the way up through oldest patient gets to be 100. And we do a lot of travel medicine. There are 4 partners in the practice, all board certified physicians, and we include travel medicine as part of our practice.
Very interesting. So briefly, define for our viewers, what exactly is travel medicine?
Travel medicine is an interesting concept. It's not one of the board certified specialties such as pediatrics or surgery. And it has evolved, it's an interest area really, that has evolved in the past few decades with increasing numbers of people traveling. There are really 4 medical specialties that are components of it. First of all is epidemiology, which is identifying diseases, identifying injuries, gathering data on them, finding out time parameters. It includes public health, the town, county, state, and federal officials who are concerned with disease transmission. It includes preventive medicine. What do we do to prevent you from getting the disease or injury while you're traveling? And of course, a large component, especially for our practice, is the medical care. What happens when you come home sick or injured from your vacation travel? We will take care of that.
So that kind of practical counseling, doctor to patient, is so important when you consider some of the challenges, if you will, of global travel. Do you think a patient should see you before a big trip, or should they simply wait to see if they get sick and then only see you after they return?
We put a big emphasis on the preventive visit. And I should define what we mean by travel. Basically, going to Canada or to Western Europe is not much different from going to California or to Boston.
Right.
We're talking about the rest of the world where the risks are increased.
Okay.
And we much prefer to see the patient before they go for a preventive travel visit.
So if somebody is going, for example, to Asia, Africa, South America, you would recommend a preventative visit?
They will very often need to see someone because of vaccine requirements for certain countries. So sometimes it's an actual administrative need for them.
Okay.
Some patients do recognize that they need special information or special medications. The one aspect of travel medicine that I think everyone who does it is a little troubled by. Patients seem to have an idea that it's almost like a vending machine. You plug in the name of the place you're going to and press a button and out comes, here are what you need to do for this trip. And it's actually a much more complex, individualized visit than that.
So let's say I'm going to India, an exotic location.
Sure.
I'm the patient and you're the consultant. What kind of interview questions are you going to initiate at that encounter?
The beginning is very much what all of us in medicine are used to doing, which is, if it's a patient who's new to us, we don't know them, is really a medical history. Age, sex, what are your medical illnesses? Do you have any? Have you had experience doing this sort of travel? Where are you going? We want your itinerary. Not just, are you going to India? Which city are you going to? What season? What are you going to do there? And how long will you be there?
Right.
All of these things make a big difference. We try to get background information on whether you've traveled before. We have patients who have never been outside the United States, and we spend a long time counseling them, especially if they're going to any developing countries. On the other hand, we have some patients who are workers for international aid organizations who constantly travel.
Right.
They've been to 20 countries, including war zones. They're quite used to all of the risks, and they simply come in before a trip because one of their vaccines has run out. They need a preventive medication. Their last prescription is no longer useful. So we have very short visits with someone like that.
Sure. And then what kind of vaccinations will you recommend depending on the geography?
Well, I'll start even before the geography. The important thing with travel medicine is to make sure that the person who's going has been vaccinated against everything that they need for the United States. For children up through teenage years, college students, usually they're up to date. They have requirements for school, requirements for college, so we don't worry about them too much. We ask them to bring any records they have with them. The middle-aged or older travelers are more of the problem. They often don't remember what they had. They may have grown up before some of the vaccines were available. Basically, everything that one should have in the United States is needed for travel. And we start right off with asking, when was your last tetanus and pertussis shot, whooping cough shot? Have you been vaccinated, or did you have the disease of chickenpox? Measles, mumps, rubella, still seen in many countries, even though we don't see much here.
Right.
For older travelers, we like to make sure that they've had their pneumonia shots, that they've had their shingles vaccine. We want everybody, if it's the proper season, to have their flu vaccine. It's not the country they're going to so much as it is that 10-hour airline flight with 100 strangers that we're worried about.
And they're all coughing and sharing
They're
their
coughing
germs.
at everyone else. It's not that they're more likely to, quote, catch pneumonia in one of these countries. It's that their resistance may be worn down, and you certainly don't want them getting a disease while they have their 2-week vacation and spoiling it.
Of course.
So that's the baseline. Then it depends on the country you're going to, and some vaccines are required for just about any place outside Western Europe or Canada. Everybody should have hepatitis A. You get that from food. You can be in the 5-star hotel, and I always ask them, and who's working in the kitchen? We have no idea. It's spread through food and water, so that's a very important aspect. Certain countries have a lot more typhoid than others. For certain trips, there are more special vaccines. You said you're going on your trip to India. I want to know, are you going to Mumbai, to the big city, to stay in a very nice hotel and to work in an office building every day while you're finishing a business deal and coming home next week? Or are you planning to backpack by yourself, maybe ride a bicycle, tour by yourself in some rural areas where there are animals with rabies who are going to be nipping at you as a stranger? So that very much changes the vaccines that you would need. So for these high-risk travelers, we may add on something like rabies vaccine.
What do you tell people that are going into, let's say, Central Africa, where there may be a risk of malaria?
Actually, malaria is risky in certain areas of India, Pakistan, Africa, and some of the South American countries. So we provide medication. We give a prescription for medication, which is obtained here in the United States. Again, we want to know your itinerary. There are different kinds of malaria. Some are more resistant to drugs than others. It helps us select and discuss with you what you need. And then we give you prophylactic medication for malaria. The other thing that we will often provide medication for As a gastroenterologist, you probably see some of these patients too. The leading cause of disease coming home from travel is diarrhea.
Right, traveler's diarrhea.
And we can't help if you get a virus on a cruise ship. We can't help if you pick up a parasite. But the common dysentery, we can give you prophylactic medication to take in case you get very sick while you're away.
Which medication are you recommending?
Depends on where you're going.
Okay.
Again, Cipro is still used in many areas of Africa.
Yeah.
However, in Eastern countries, Far East, the Indian subcontinent, Cipro has been around and sold over the counter for so long that there's almost guaranteed resistance.
Yeah.
So we currently are mostly using azithromycin.
And I would add to that, as a gastroenterologist, we tend to favor Xifaxan, rifaximin for traveler's diarrhea.
Do you find that it's highly expensive? That has been our one problem with
Yes,
it.
it's expensive, but it's effective and extremely safe because it's not absorbable.
True.
Cipro, our concern as GIs is that it's now the leading cause of Clostridium difficile toxin colitis. So as a result, and you also mentioned the drug resistance.
And the third thing we can add on, and we see more of this or hear more about this in primary care, is people who rupture tendons
With the
from the
Achilles
risk of the
Cipro.
Cipro.
Yeah, yeah. Are you a fan of using preventative probiotics, healthy bacteria, while people are traveling?
We try to encourage it.
Yeah,
It may cut your risk a little bit. It may make the course milder.
yeah.
The other thing that we will occasionally use, and this is not for the average traveler, but there are people who are making very important trips and short trips. This might be a business trip where some important contracts are being signed. You're only going to be away for 2 days of meetings. It can sometimes be scientists who are going to give a keynote address in a foreign country. They cannot have diarrhea
Right.
during the meeting. Sometimes when it's a very short meeting, we will have them take azithromycin as prophylactically just for the 2 or 3 days that they'll be away.
Sure, sure. If somebody is in a malaria zone and they've either been non-compliant with the preventative antimalarial or it simply hasn't worked, what would you tell somebody who comes back from a trip and then days or weeks later is having symptoms of malaria? What kind of symptoms should they look for?
High fevers,
Okay.
not too much else, but very high fevers. We're lucky in the Washington area because whether they come to us, whether they go to the local emergency room, people, the emergency room physicians in this area are quite used to seeing travelers, immigrants, people who come in with diseases. So it's on their radar screen.
And how do you diagnose it?
Blood smears,
Right.
blood tests.
And that will show?
That shows the organism inside your red blood cell.
actually see
and
the parasite.
You actually see the parasite when the lab stains that slide.
And then if it is diagnosed, it's also treated with pills?
And it's also treated with pills.
Okay. Well, we're going to pause briefly for a public service announcement. When we return, more with Dr. Jane Chretien, an authority on travel medicine. We'll be right back.
Maybe you can make retirement happen. After all, you made this vacation happen.
Double points with every purchase?
Cleverly merging promotions,
Love it.
cross-referencing travel sites, and booking all your flights with those.
Vouchers. I got us bumped.
They were like, oh. But now they're like, aloha. You aced this vacation. Now get the tips you need to get on track at aceyourretirement.org.
It takes less than 1 minute to find out if you may have prediabetes. You can do it here. But I get it, you're busy, and busy people can't have prediabetes. I read that wrong. They can, okay? Just go to the site.
We're back with my guest, Dr. Jane Chretien. Our topic tonight is travel medicine. Dr. Chretien, before the break, we were discussing traveler's diarrhea, treatment, prevention. What are some of the common sense things a traveler can do to greatly reduce their risk of traveler's diarrhea?
Well, we can go into it in more detail, but the way to summarize it is a little saying that came from the infectious disease societies, which is referring to your food, boil it, cook it, peel it, or forget it. And that sort of summarizes it. You want to eat things that are steaming in a pot, boiling for hours, stews, lentils, things that are simmering on the top of the stove. You want to eat fish or meat that has been just taken off a grill and is still hot. If you want fruit, it should be something you can peel. So mangoes, bananas, oranges are fine. Don't try strawberries. Hot water for coffee or tea. It's been boiling, that's fine, but otherwise, bottled water or boiled water. You can brush your teeth with the boiled water or bottled water. Ice cubes are dangerous unless you know that it came from safe water.
Right.
So it's pretty easy with common sense to summarize. In fact, I have a patient who, for decades, has done aid work throughout the Middle East, in war zones, and throughout some of the Central African countries. Short trips, but he's constantly back and forth. I saw him recently, and we were talking about diarrhea, and I asked him, how much of a problem is it for you? And he said, I never get diarrhea.
Wow.
So I said, what's the secret? And he summed it up by saying, I don't eat salad.
Yeah. Interesting.
But we really say stay away from fruit salads, stay away from green salads, make sure all your vegetables are well cooked.
Yeah. So you mentioned some of the societies. What are the professional societies that serve structure and guidance for specialists in travel medicine?
The biggest one that we use for reference is our government agency, CDC, the Centers for Disease Control, which is a large government agency located in Atlanta, Georgia. They publish all the guidelines for foreign travel, and they update it frequently. They can be checked, CDC can be checked at website. In fact, patients who are traveling to an area can check a patient-friendly zone on their website for the country they're going to. So cdc.gov.
Very nice.
They also give us guidelines when new disease outbreaks come around. So it's not simply the book that's published every 2 years. There are constant weekly and sometimes daily updates that we get via internet of new disease outbreaks in countries where we hadn't known. A new polio outbreak, for instance, in a certain African country. There's also a society to which most of us who do travel medicine belong, the International Society for Travel Medicine. This is an international society, so it includes travel medicine professionals from all over the world. And we will communicate very often through their website. So if you have someone who's going to a rather remote destination that there isn't too much information about, the chances are you can find a physician practicing in that area who can give you an update on, do they have malaria in their province or their city?
Sure.
Is there a certain hospital around it can be referred to? So we get a lot of information from that. And then the final thing is the World Health Organization also issues guidelines.
Very helpful. Now, we, of course, in the first half of the segment, focused on some of the infectious disease concerns when you're an international traveler. But it turns out that's not the only thing travelers should look out for. Share with our viewers what are some of the other potential issues you can run into when you're a global traveler.
I think it's very important to bring up these issues because one always thinks of travel to a developing country. What is going to get me? It's going to be malaria, it's going to be dengue, it's going to be something rather exotic. If you look at the figures, first of all, for deaths among travelers, the largest number are from accidents. Travel accidents, auto accidents, motorbike or motorcycle accidents actually lead the list.
Yeah.
Adventure travelers also often have high risk. Scuba diving in an area where maybe the regulations aren't quite as they are in the United States. People who do animal rescue in countries where there's lots of rabies.
Yeah.
So there are risks from physical problems. Mountain climbing. Machu Picchu in South America is now a very popular destination, we find. You climb to see all of the old fortresses at between 10 and 11,000 feet. Most people, or many people, will get altitude sickness over 7,000 feet. That's something that we address if that's on your itinerary. Occasionally someone will die because of disease resulting from that. It can be something as simple as airline travel, getting a deep venous thrombosis in your leg from sitting 10 hours in a crowded airline seat. You get a pulmonary embolus, may need hospitalization.
A clot that goes from your leg to
A
the
clot
lungs.
from a leg to the lung, and that can be fatal in some conditions.
So you touched upon
So-
some interesting areas. I want to circle back
Sure.
to them. So global travel, long distance flights, somebody's at risk for a clot in the leg that then shoots up. It's an embolus that could be life-threatening
Yes.
in the lungs. What can the traveler do to make it less likely that will occur?
Well, we give instructions, although the airlines probably don't like it. Get up as much as you can, stretch out, move your legs around. Don't stay in that cramped seat for the 10 hours without moving.
Why does walking help?
The muscles in the leg work on the veins, and it prevents the blood from forming clots there.
Okay.
So walking around is important, and for the same reason, you don't want to get dehydrated. So we encourage you to drink a lot of fluids, preferably not alcohol on these long airline flights, but drink plenty of water. We also suggest for long flights, anything over 2 hours, to use knee-high elastic stockings, which can be obtained at a local pharmacy or over the internet. That will help the circulation in the legs. And for special travelers, for people who've had clots before or who genetically may have high risk of clots, we actually will give heparin shots, have
Really?
them take a heparin shot for flights longer than 3 hours.
Now, do you recommend for travelers on long flights, if they're not already on aspirin to prevent heart disease?
It's probably a good idea. I don't know whether studies have been done as far as aspirin preventing, but we feel it can't hurt. So I think that is a good idea to take an aspirin.
Okay. Now let's circle back to Machu Picchu, which I have had the pleasure of exploring with my wife. So let's talk about high altitude sickness. What do you recommend to your travelers to prevent high altitude sickness?
Well, again, we get back to the basics of drink plenty of fluids, stay very well hydrated. Probably not a good idea to drink alcohol at these high altitudes. The other thing is slowly getting acclimated is very important. Unfortunately, on vacation, people don't often have time to do that. But if you are, trekkers, for instance, will often have the ability to stretch out the trip so they can go no higher than maybe 500 meters per day. That seems to prevent it. People who climb Kilimanjaro have much fewer problems if they do it in a very slow way as opposed to just rushing out. Camp at different altitudes as you go and get used to it. We give the same advice actually to people in the United States who go to Colorado and who like to ski at high altitudes. We tell them, don't go there early morning and decide to ski in the afternoon.
Right.
You will get sick.
You get acclimated.
Spend a day acclimating. But in addition to that, for anything over 10,000 feet, we can give a prophylactic medication called acetazolamide, which they take for a few days.
Also called Diamox.
Called Diamox, yes.
Right. And that is useful to prevent?
To prevent the altitude, the acute, what's called acute mountain sickness, the
Yes.
feeling of complete lethargy, short of breath, headache, nausea.
When we went out to explore Machu Picchu, we pre-medicated with
Yes.
Diamox, which worked very well. And interestingly, the local natives there also advocate that you use a coca tea, which they claim reduces the risk of high altitude sickness. So we tried both. And happily, our trip went fine.
I'm glad the trip went fine. We will probably blame the trip going fine on the Diamox.
Yes.
Data is sort of missing on the cocoa leaf.
Sure. So do you find that there's certain parts of the globe, I'm not talking about war zones now, but certain parts of the globe where you advise travelers to think twice before going, that you're concerned about unique issues to that part of the world?
I think the unique issues turn around their basic medical problems.
Okay.
For instance, if someone has already underlying lung disease, underlying cardiac disease, someone who might have to use oxygen at home, or at night at least, we would not advise them to go to Machu Picchu.
Right.
We would say, if you're hitting South America, see if you could do a jungle tour instead. So it revolves very much around their own health status.
Sure, sure. And do you find that with the global statistics about travel medicine that violence is a concern, particularly against Americans?
Well, I don't know if it's against Americans, but if you look at what do people die of in developing countries, as we mentioned previously, car accidents are at the top of the list. However, not too far down is homicide.
Really? Terrible. Robberies and
Robberies.
the like. Yeah.
Fights, young people getting into fights in areas where they're not familiar with the city, perhaps.
Right, right. And of course, a lot of attention was paid just a couple of years ago to Brazil and Zika virus. So what are you advising your patients about traveling to anywhere where Zika's present? It's not just Brazil, but it's a global issue. What would you recommend to somebody who is considering going to Rio for Carnival, for example?
Well, for any of, and a lot of the Caribbean countries have it as well now,
Sure.
where people just go for short vacations. Again, it depends on knowing your prior health status. For a pregnant woman or a woman who's planning a pregnancy in the next 6 months, we would say don't go.
Really?
For other travelers where there's no chance of pregnancy involved, we say it's pretty much the same as preventing other mosquito spread diseases. Dengue, Zika, chikungunya, there's a whole list of them that can make you quite sick, and the prevention is mosquito prevention. And that goes for malaria as well. Even though we give you malaria pills to take, we still like you to avoid the mosquito bites. It means using mosquito protection, long sleeves, long pants, hats, lots of anti-mosquito medication spread over your face and your hands. In some areas, if you're not in a good hotel with good air conditioning, travelers to more primitive places will often purchase bed nets and stretch a gauze material, which is permeated with anti-mosquito materials. They'll spread that over their bed at night just to prevent mosquitoes from invading.
Jan, we have 1 minute left. What are you advise travelers who are considering travel insurance?
I cannot recommend a given insurance, but I would say certainly look into it. Sickness, injuries can happen at any time, and if it's serious, you would like to be evacuated very often back to the United States.
Sure. Well, thank you for joining us on Housecall.
It's been a pleasure.
Yes. My thanks to Dr. Jane Chretien for an excellent interview on travel medicine. My thanks to my terrific team here at the station. And finally, my thanks to you, the viewer, for welcoming us into your home. Tell us how we're doing. You can reach me at my practice website, montgomerygastro.com. As for our next show, it's going to be very interesting. Dr. Suresh Gupta, a specialist in geriatric medicine, medicine for the aging, will be focusing entirely on that program. It's going to be a very interesting show. Look forward then to seeing you next time for another edition of Housecall. Good evening.